Move on to the next question. Andy, why do women cost more than men? Aren't men more reckless? The answer is yes to the last part, probably. I know that as a kid, as a child, I grew up in the emergency room being a sports guy, my poor mom. So I would say yes, but that's children, and I don't think that's what you're talking about. You're talking about men. The answer is that it's all about actuaries and the insurance company. All they care about is claims. All of their numbers are derived from claims. Women have their yearly exam. If you take all of the women in the United States, multiplied by that yearly exam, a mammogram is about $100. Yearly exam is about $75. So let's call it 200. I put it to a calculator. Let's say there's 100 million women going for their yearly exam. Anyway, the calculator blew up. That's why women are more expensive. During their childbearing years, what you will find is as women get older, it starts to come together. 50, 55, 60. By the time you hit 60, the pricing is just about the same for men and women. So it's all about the yearly exam, not about being reckless. Next question. I was canceled because I did not pay my premium on time. I am very upset, and no one seems to give me a straight answer. Can you advise me, please? Yes, I can. But I don't have all the details, and thank you for the question. You can be reinstated. There's a 30-day grace period. They wouldn't have canceled you, so it must be over 30 days. First, let me tell everybody out there, put yourself on automatic billing, where they take it out of a credit card or a checking account automatically so you don't have to worry about it. That's number one. Number two, if it's within 30 days after that grace period, your broker should be able to get you reinstated. I get people reinstated as often as needed. So reinstatement is the call to action here. Now, if it's been many months, you're going to have to reapply. And if it's a reapplication, the problem with reapplication is if you have a health condition and that health condition occurred while you were insured, the problem is now you're going to have to pay for that health condition. So when you got insurance, for anybody, if you had no health condition, you got the best possible premium at that time. So you can develop any health condition after, and they'll never raise your premium based on health condition. And you know, people say a lot of things about insurance and this and that. Insurance saves lives, and I'm not going to get off on my soapbox about that. But let me just say this, that in auto insurance, you get a fender bender, they're raising your rates. You get a ticket, they're raising your rates. In our business, you can get anything after the fact, and it's not going to affect your premium as long as it wasn't a pre-existing condition. If it was, you're going to be booted out. So again, get insurance while you're healthy, young, keep it for the rest of your life, and then ultimately hang on to it until you turn 65 years old. So if you want to shoot me an email, it's andyross@cox.net. Give me the timing on it. I'll answer, look for my email. I will email you and just tell you to email me back on the specifics and the timing, and I can help you get reinstated. You didn't say who you were with, but I'll tell you what to do and how to do it, and we should be able to take care of this matter for you, and I appreciate the call. The email, and that was from Wendy. Thank you, Wendy. How do I know who to get insurance with? Good question. I advocate household names. What that means is the New York Yankees are the New York Yankees. The Red Sox, if it's a major league company, you're fine. There's no lousy insurance company. There's no lousy plan within an insurance company. What there are is different parameters. Deductible varies, co-pays vary, so it all comes down to budget. So, you know, think about what your budget is. Go with a household name. Be comfortable with their reoccurring price every single month. So, like I always say, I'm not in business to break anyone's bank account. What I'm in business to do is help people, save lives. And you know, the person that I mentioned in one of our earlier shows that had lymphoma, we're going to have to break for a message. I'll be back and I'll continue. Thank you very much.